We are really, really excited to have Dr. Colin King and Olivia Falconbridge here. So I'm going to pass it over to Tracy at Wellspring London to do an introduction for us.
Perfect. Thank you so much, Lauren. My name is Tracy Jones. I'm the Executive Director for Wellspring London and Region, and my colleague Valerie and I are really, really pleased to work with Lauren and the team to put this presentation on today. We're so very fortunate that we have so many experts in our field within our region, and Dr. Colin King and Olivia Falconbridge are two of those experts that we've called upon to provide us really with an interesting topic that I think everyone will benefit from. Dr. King is the director of the Child and Youth Development Clinic at Western University and is an associate professor in the Department of Education. He's also worked as a clinical psychologist. And Olivia Falconbridge is a resident, a psychology resident at the Child and Youth Development Clinic and a PhD candidate in the School of Applied Arts and Psychology program at Western, and works very, very closely alongside Dr. King in her work. So we're really grateful for your expertise today and for the time that you're taking to be able to share the information with our Wellspring members and our community at large. So I won't take up any more time. I'll pass it over to yourself, Dr. King, and thank you both again.
Wonderful. Well, thank you, Tracy and Valerie and the Wellspring team there for the generous introduction. And no, we're extremely pleased to join you today. You can see the title of our talk there, What About the Kids? Children's Mental Health with a Cancer Diagnosis. And Olivia and I are really trying to take us on a bit of a journey today during kind of the 45, 50 minutes we have here to really kind of outline some of our current knowledge around supporting kids with the cancer diagnosis, some of our survivors, and thinking about how we can support their mental health, both certainly kind of during treatment and care, but also some of those longer term pieces there as well. So we really have kind of three goals for today here, certainly to discuss some of the impact of cancer on children's mental health. Olivia is going to be highlighting some of the example programs across Canada here to support children and youth and relate that back to some of our current research about what we know on intervention and support mechanisms for children, youth, and families. And then we'll do a little bit of a preview, thinking about some of those continued kind of next steps about what we know from the literature, other kind of clinical developments around youth programming to support our kids, thinking kind of longer term about the mental health impacts and what families need there. So I just want to start off a little bit just situating kind of myself and Olivia in the context of today's talk. So as Tracy mentioned there, I'm the director of the Child and Youth Development Clinic. We're a training clinic here at Western University where graduate students provide services to our community under supervision of registered psychologists and professionals. And over the past 3.5 years here, we really offer a range of services from both kind of assessment services, intervention services, both individual and group, and offer a lot of kind of professional development and programming supports to our community there as well. On the right-hand side there, you can see just some of the examples of some of the intervention programs that we've either developed on our own or implemented here at the clinic. Certainly kind of in-person pre-COVID days, but now increasingly kind of virtually online there as well. And as you look at some of the different intervention programs there, what you won't see is specific support groups or children's groups for kids with cancer or caregivers of kids with cancer there. So in this regard, Olivia and myself are really coming here as, in some ways, as kind of novices, and I'm really thankful to Tracy and the team here for the opportunity to really look at the literature from our end as, again, kind of novices, but then to kind of share this back with you here today to see how are some of these findings and results to date kind of in parallel with perhaps kind of some of your experiences, or are there some other elements here that might kind of discrepant as well. So really hopeful we can talk about that in some of the chat. But I really want to kind of start off today with really providing a bit of a context to think about kind of all the differences in knowledge that we have here at different time points for kids. So when we're thinking about mental health, I really want you to kind of be thinking about it as this model, sometimes what we call a dual access model. So you can see here in kind of the light green here, there's one continuum that talks about symptomology of a mental health condition. So that might be mental health condition that, perhaps like anxiety or depression, where again, closer to the end of one continuum might be kind of more consistent with a diagnosis. On the other end, there are kind of fewer symptoms that are classically matching up with that diagnosis kind of profile. On the blue or teal continuum here, you can see around kind of a continuum specifically about kind of mental health, having kind of more positive mental health and kind of more poor mental health. And I present this diagram because it's a nice way of kind of making sense of some of the results and really describing where kids and families might be at a particular point in time. So if I think about here in the top right-hand corners, this would capture perhaps individuals who do meet criteria for a mental health diagnosis, but at the time are experiencing positive mental health. And I'm always thinking about perhaps kind of some celebrities. I always think about Clara Hughes, the Olympian cyclist, who's been quite open about her experiences of depression, perhaps still meeting criteria for depression diagnosis, but through medication, through positive coping strategies, support systems, we'll often talk about managing her depression quite well. So I think about perhaps individuals like here as kind of fitting in that kind of quadrant. At the same time, we know that there's lots of different time points where our mental health is quite poor and it may not align with a mental health diagnosis, but again, we're really kind of struggling. So just about half an hour ago, I was talking to Olivia saying, right, so this was perhaps my family and I during first wave COVID with at-home remote learning, right? We certainly weren't thriving, we weren't doing well, and we were really struggling. And again, I don't think we would have met criteria for a mental health profile, but we were certainly under duress and struggling at that point in time. So in this bottom right-hand corner there, again, those that do meet criteria for mental health diagnosis and are really reporting symptomology and experiences really indicative of kind of poor mental health. And that's really when we're reviewing some of the literature here today for kids with the cancer diagnosis, looking at their mental health profiles, is we're really focusing on these two quadrants. Because often some of the studies don't distinguish between those two quadrants. It's really hard to tell. So I'll be talking about more generally about how those kids are doing. And when we're talking about intervention supports, we're really trying to kind of promote the functioning and well-being for kids and families to be in these upper two quadrants there, where again, they may still meet criteria for a diagnosis, but that they're really reporting kind of positive mental health longer term. So just introducing that as one way of kind of making sense of some of the results here today. So I want to start off by talking a little bit about what we know from the literature about how kids are doing mental health-wise for those with a cancer diagnosis. And again, this certainly won't be news to any of you in kind of our virtual room here today, and you'd have a much more lived experience and expertise on this than I do. But we certainly know how that the journey of receiving a cancer diagnosis, receiving support, treatment, and care is really fraught with multiple and pervasive stressors for kids and families. Thinking about the daily lives and routines that are disrupted, the removal of a lot of those positive coping and mental health support mechanisms. I think about kind of more recently with kids kind of being at school and our kids being at the hospital for treatment and care. We know that there's disruption in social and family roles where caregivers are having to change their responsibilities and care, impact on the family system and siblings. We know from the literature the financial impacts as well about many caregivers having to take time off work or with all the associated costs of caregiving and medical treatments there. We also know, and that's even kind of prior to the actual kind of treatment process, we know that medical procedures are stressful and painful, can have different side effects over time. And certainly that ongoing threat and concern about the child's health and quality of life is part of that. So when we're trying to situate how kids are doing and families are doing in this process here, just at a very kind of basic level, we can think about all these disruptions about very practical realities and stressors that are present that are going to have an impact on one's kind of mental health and well-being. And when we're looking at the literature, again, this was, a bit kind of novel to me, is when we're looking at particularly some of the kind of early literature early on, is that there is quite a variability around reporting how kids and families are doing during these kind of short-term pieces there. Is that there's really a wide range of variability in how kids and families are coping. And some of the early literature really talks about some of this positive resilience of kids early on in regards to cancer diagnosis and kind of the treatment process. But we do know as well that there is a smaller subset of those kids, often 10 to 30%, that are reporting ongoing kind of mental health needs, and particularly around the family impact, about how caregivers and families are adjusting, even though kids might be appearing on the surface to be doing kind of well at kind of the short-term kind of acute pieces there. And I'll be talking a little bit about some of the longer term kind of needs and concerns, but we know, again, kind of with some of this variability, that we need to take into account what they call PTE, or potentially traumatic events. And on the flip side of that is some of those kids and parents that would meet criteria for a post-traumatic stress disorder diagnosis. So in this kind of range, again, I think back to the dual access model that I showed before, because it really does present kind of a mixed picture of some kids early on kind of doing quite well, at least on the surface level, of having this positive resilience and adaptation to some stressful events. But again, this variability of some kids who are also going to need some more support, and thinking about the longer term mechanisms. And one way to kind of think about this is around kind of a clinical tiered intervention model. You can see here in this kind of triangle diagram where we're talking about some of these families who are distressed but appearing resilient, but that there's some universal care mechanisms that can really support these kids and families. And as we're going up the pyramid there, we can see some of the increasing distress and reported kind of poor mental health. So at the targeted level, we can see kind of more acute needs, some of those who might be displaying increased risk factors for longer term ongoing needs. And that at the very tip of the pyramid, or in the iceberg there, really thinking about those who are going to require perhaps our kind of most targeted and kind of intensive models of support. And again, I go back to this here because it's not that all well is good here, despite some of the research suggesting that, because that a lot of these families are reporting some of those high levels of distress and symptomology. And that's where there's been some evolutions in some of the models of support and care models here that is really looking at, rather than kind of a static clinical intervention kind of pyramid here, really trying to capture some of these needs over phases. So you can see in this model here from Kazak and their colleagues there, 2007, really talking about some of those kind of immediate needs following cancer diagnosis and treatment and care, but then really expanding that to be looking at ongoing needs and then longer term needs there as well. And that's really where we do begin to see some increased concerns about how kids and families are doing. And the literature really kind of spells this out as some of our cohort studies and outcome studies are continuing, increasing recognition of some of those longer term distress pieces in both kids and kind of parents. And there's been a real focus on what they call post-traumatic stress symptoms. And that when we use this kind of larger heuristic to look at how kids and families are doing, that there's many more kids and youth that are kind of fitting those profiles. Because and we won't have time today to really kind of delve into it, but we know that that formal PTSD diagnosis is really problematic for kids and youth. It's really based on adult experiences. The symptoms don't kind of line up the same way. And we know that currently about kind of 5 to 10% of kids would meet that formal criterion. But again, thinking about that iceberg analogy, is that there's a lot more kids who are exhibiting needs that we can help support. And that's where if we look at some of those range of needs, we're certainly seeing at kind of individual and family psychological levels around stress, anxiety, depression, self-esteem, psychosocial needs, so how kids are getting along with peers, fitting in with their school communities, how they're doing at school. And a lot of that is also often related to some of those neurocognitive effects of treatment there as well. And that's where we do see some of those longer term academic concerns and other delays in some areas. Again, thinking kind of longer term following treatment care. And as we're sitting here into kind of the second wave of the COVID piece, I think we can understand that too, thinking about some of those short-term adaptive needs, but as those concerns continue on, just the exhaustion of some of those adaptive coping, right? About being able to do well in the short term when there's some really kind of acute pressing needs, but as those needs continue over time, we're really seeing some of that caregiver burnout and those other mental health needs really kind of come to the forefront. And that's where we really need to appreciate some of the distress and needs that will be required using a much longer term kind of picture there. So I wanted to kind of introduce that as a model, because what I'll do now is turn it over to Olivia to talk a little bit about kind of the snapshot of some of the current care resources and programs across Canada to look at what they're kind of doing, and then we'll relate that back to some of our current kind of research on intervention models and what we might be able to learn there. So I'll pass it over to you there, Olivia.
All right. So given our understanding of the way cancer diagnosis, treatment, and experiences can lead to significant social, emotional, and psychological consequences for the children and families that are dealing with these difficult issues, it's important that we know how we can best support them in our communities across Canada. And so I spent some time looking at what is available for these children, adolescents, and families. And what I found was that there are a number of groups targeted at supporting parental distress, sibling stress, supporting families in the loss of a child in their grieving and bereavement period, and some social camps and events for families and children with cancer to provide that opportunity to engage in some social time and build some community for themselves. What I also found, though, was that their children and adolescents are often receiving fewer supports following their hospital treatment and while they're in treatment. And in the research, children and adolescents identify that it's difficult for them to locate and access resources in their own community that can support them in that time. We'll go to the next slide. So I'm going to go over a couple of groups that I found, and this is not an exhaustive list. It's just a list of 4 groups that I think really exemplify what we have available for children and adolescents across Canada. The first group being the Lucian Group, which is in Quebec and Ontario, and it hosts year-round events for youth and families to meet each other, develop some kind of social time and community, and they have some family and peer informal support networking times as well. So this is kind of an important one for them just to be able to build some community and interact with each other. And then the next group is the Childcan Group. And this is available in the southwestern Ontario. And they provide a number of programs for children and families around education and academics. The first program is the Early Years program. And what they provide there is really support for those kind of preschool and early elementary school years, where when kids are out of school and out of their kind of preschool environment, they're maybe experiencing some delays in their social, emotional, and academic development. And the program is designed to kind of support them in building those skills in the social, emotional literacy, numeracy, and motor skills. They also host a number of family fun days, which I said before are really important for kind of just giving that time for a break, giving some time for kids to spend time with each other, get to interact with peers that kind of understand their own experiences. And then they have the educational support program and volunteer tutoring program where they support families in kind of understanding how to navigate school and kind of treatment, and support kids in being able to successfully catch up to their peers and use their tutoring time effectively. The third program is the Kids Kicking Cancer, which was an exciting program to find. It's an evidence-based program that integrates medicine and martial arts. And their goal is really to provide children who are in inpatient or outpatient care and their siblings with a sense of power and control. And they teach them breathing, visualization, and relaxation techniques, as well as martial art moves. And this program is across Canada, and they're affiliated with 50 hospitals across Canada. And they have kind of built a system where they can provide in-person groups where kids can interact with each other and learn these skills. They can also do them obviously right now virtually in a group setting or individually. So it's an exciting group that they have available. And then the last group that I'll present is the Kids Cancer Care, which is available in Alberta. They have Camp for Children with Cancer. They also have a peer exercise program, which is for kids on or off cancer treatment to participate in physical activity with peers. And what they found with this is that they're able to provide opportunity for some social time and that the participants have improved academic performance. And they have the tutoring and educational support. And in the Cancer in the Classroom program, they help children to teach their peers about their cancer diagnosis, the treatment that they went through in kind of a classroom presentation program, kind of giving that support to re-enter the classroom, as well as matching cancer survivors with tutors that can support them in their academic development. So in looking at kind of those 4 examples, they're not an extensive list, but they are what is available. And so looking to the research to see, what more can we be doing to support children and adolescents at this time when they're receiving a diagnosis or in treatment or following their treatment. What I found was similar to what we see in the community. Most research is focusing on families, siblings, and then survivors of cancer. There is little research at this point that's examining intervention programs specifically for children and adolescents that are currently in treatment for cancer. And as a result of that, there's not really a consensus on the best intervention for the population. What we're hoping to do is kind of using the information that I've been able to find in the research and our own kind of experiences in supporting children and adolescents here at the clinic to be able to provide some kind of recommendations and ideas around what we can be doing to just best support kind of these kids and adolescents across Canada. So we'll start with mindfulness interventions. A large area of research examines mindfulness interventions for children, adolescents, young adults, and adults, either dealing with cancer or as survivors of cancer. Mindfulness is described as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And mindfulness-based stress reduction programs are designed to teach participants about mind and body awareness in the goal of reducing physiological effects of their stress, pain, or illness. And most of these programs include aspects of mindfulness meditation, body scanning, mindful eating, and just kind of a better kind of sense of awareness and connection with their own bodies and ability to relax and kind of control how they're feeling. So I'll go through a couple of studies. Most of these studies are for children, adolescents, or young adults, and they kind of cover 6 to 8 week mindfulness-based stress reduction programs. In the first one, they looked at children and adolescents, and they found that participants in the group experienced decreased symptoms, including lower pain and distress, and they described having an increased quality of life. And the next 2 are kind of more focused on adolescents and young adults. The first one is an adolescent mindfulness-based intervention group. It was a small intervention and study, but what they found kind of qualitatively was that these adolescents identified that just having that opportunity to be in a group and kind of speak openly about their emotions, about their cancer experience with peers that had similar experiences was something that they really enjoyed having. They also identified that learning about mindfulness helped them to identify their emotions and manage their stress as they were entering schools. We know that can be kind of a stressful time for them as they've been in kind of cancer treatment and have been out of the school environment. Re-entering the environment can be anxiety provoking for them, and having that mindfulness supported them. And then they were also able to manage their stress before treatment. So we know that kind of that medical situation can cause a lot of distress for children and adolescents, and being able to use mindfulness, they were able to reduce their distress as they were entering any kind of treatment scenario. And then the last one is the adolescents and young adults diagnosed with cancer. When they engaged in mindfulness, comparing them to groups that did not engage in mindfulness, they found that they had lower psychological distress and uncertainty score. So just kind of less fear of that unknown and where are we going next and what's going to happen with kind of cancer and the treatment. And overall, they had better emotional outcomes following their treatment than participants that didn't engage in mindfulness. So really what we're finding is that mindfulness-based programming can really support that ability to manage distress, reduce anxiety, provide an opportunity to interact with peers that really understand what we're going through, and help us to kind of have better outcomes overall. I will kind of go over a couple of programs here where they have developed programs for adolescents and young adults that are cancer survivors. The first group is a Recapture Life Adolescents and Young Adults, or as they called it, Recapture Life AYA. It's an online CBT-based intervention. So CBT is cognitive behavioral therapy, and the focus is on how thoughts and emotions affect our behavior. What they kind of focused on here was teaching resilience and coping skills for young people and their families to ensure that they had kind of better overall outcomes following cancer. So they taught them to restructure their thinking around cancer, their experiences, going in for checkups, and then life overall. And in the study, what they found was that kind of the participants, adolescents and young adults, had a really negative perception kind of overall of their lives and their cancer experiences. And in using CBT, they were able to learn how to reframe their thinking and be more positive overall about their lives, their functioning, to reduce their stress and anxiety, and manage their treatment, manage their stress around checkups and their anxiety. And then the second group is the Surviving Cancer Competently Intervention Program. This again is a CBT-based program, but they also include family therapy to reduce post-traumatic stress symptoms related to cancer experience. As Colin mentioned earlier, there's a wide range of research that really focuses on the idea that engaging and having to go through cancer treatment can cause a lot of stress that can be similar to post-traumatic stress disorder, and sometimes can lead to a diagnosis of post-traumatic stress disorder. And so this program targeted anxiety, beliefs about cancer and treatment, social support, and family communication. And what they were able to find in these, they did a number of studies, was that for all of the participants, and so that was adolescent survivors, their mothers, fathers, and siblings, post-traumatic stress symptoms reduced, and then hyperarousal also reduced. So that's kind of irritability, anxiety, feeling hypervigilant, just feeling kind of overall distress. That went down for kind of all members of the family. They also improved cohesion and orderliness in the family. So just being able to kind of work better as a family after having gone through a really stressful time and having to kind of leave that family dynamic for a period. Survivors reported positive gains for life engagement. So just feeling more connected to their lives, feeling like they have goals and that they can kind of be positive about the goals that they have for their lives. And then lastly, having open communication about their cancer experiences with the family. So this situation, again, participants talk about this being unable to talk to parents or peers or family members about the experience of having had cancer and gone through that treatment. And they expressed really having appreciated having the opportunity to open up that communication and be open with each other about, you know, how difficult it could have been for them, and just being able to really interact around that. So I'll go back to Colin here to talk about our focus moving forward.
That's great. Thank you, Olivia. And no, thank you for highlighting those programs. And again, I think for Olivia and I here, you know, certainly not enmeshed in this world that you are in different corners of Canada here. It's really, I guess, an interesting look from our lens, trying to think about, again, these different programs, what we know from some of the literature. And again, in my work around kind of program development and working clinically with children and youth, I'm often at a point now in some of our work where I'm trying to look at some of those commonalities across programs or processes, whether that be at an individual level, group level, or family level, looking at these different programs and thinking about what are the kind of the common ingredients or common elements across these different programs. And that's certainly something we're doing kind of in our group kind of programming there, but also connecting it to what we know about generalizing some of those skills and experiences that we're kind of learning in group. And what I've highlighted here on the right-hand side is a graphic from CASTLE. And if you're not familiar with CASTLE, it's the Collaborative for Academic and Social Emotional Learning. And social emotional learning has really taken off, particularly in education, but also has some kind of real relevance around mental health as well, where we're thinking about how can kids and youth and families learn some of these skills that can be generalized and applied kind of across settings. So if you're looking at that graphic there, what you can see there is part of those Trivial Pursuit pie slices there are different skills or domains that are often thought about in these different kind of promotion of kind of skill programs. So that's something I'm going to be talking about as we look at the commonalities there. Because for us, I think one of the pieces that really sticks out and rings true across the programs and experiences there is therapeutically thinking about what participants are participating in these various programs and supports. And a common thread there is certainly around that validation of experiences. We know receiving a cancer diagnosis, going through that treatment and care process, both as a child and youth, but certainly as a family, is such a unique experience that many others would not have had and might have a hard time connecting to. That validation, whether it be individually, but in a group format, to hear about all those unique and stressors and demands through that process, to on a parent caregiver end, to talk about what that's like supporting their child and the fears and worries we have as a parent. But also to really communicate that in really kind of open and safe ways. Again, building community together to talk about these unique experiences that, again, kind of well-meaning friends and colleagues can certainly help support, but it's very different to be connected in a community with those who've really had to walk this walk and deal with these stressors the way that many kids and families have to. I also look at some of the commonalities, again, looking at the different intervention programs and relating that back to, again, kind of our castle graphic here about what some of these skills and experiences are being promoted in those programs. Certainly a big one is around some of that social awareness, going back to communication, developing relationships across peers, for an 8-year-old to talk with another 8-year-old who's been through the cancer treatment process and what that's like to have missed school and continue to receive follow-up care, to develop and have that kind of shared experience and narrative together is incredibly empowering and therapeutic. Livy just spent some time talking a little bit about the particular programs and the research and that big component there around mindfulness and other relaxation techniques that fits in well with, again, that quadrant there around kind of self-management. Oh, there it goes, self-management. About being able to have tools and experiences there that when we're feeling distress and other uncomfortable symptoms, to be in that moment, to bring down some of those uncomfortable feelings. And in general, some of that promotion of general kind of coping or adaptive skills for dealing with some very difficult stressors that come as part of being a cancer survivor. So again, in this particular area, that really relates to, again, back to some of that self-management about how are you going to kind of solve and cope with some kind of very real issues and struggles, both, again, kind of an individual child level, but also as a family. When we look at that castle graphic and some of the areas that there could be some continued kind of further evolution and focus on, a big one is around that, what clinically we talk about as a distress tolerance, is that it's not just about symptoms of anxiety or depression, it's this whole kind of wave of uncomfortable feelings that come with having to deal with very difficult things. And again, that also relates to that self-management idea. And I'll talk a little bit more about that, but it's about building some of those skills to be with those uncomfortable feelings in the moment and to feel like, hey, I can kind of take this. I can manage this, even though this is something that is quite challenging. And lastly, there's something that tends to not be incorporated quite as much that could be a focus kind of moving forward as well, is around some of these different kind of cognitive techniques and really that promotion of thinking skills. And if we go back to what Olivia is talking about there about cognitive behavioral therapy, that's really this kind of broad idea that how we think and perceive and appraise a situation is going to impact our feelings, and how we're feeling and thinking about a situation will naturally impact how we're behaving and dealing with that situation. And that's really such a core foundation with the social emotional learning now, and is increasingly being incorporated into other elements as well in education, So if you're coming in here today from Ontario in the new health and physical education curriculum, we're actually talking about that connection between thoughts, feelings, and behaviors as early as grade 1. And that's where a lot of these therapeutic programs and individual support work really connects to that at an individual level for kids. Because again, being able to make sense of and to understand what's happening in a particular moment when you're faced with the stressor, not that it alleviates that distress, but it can make it feel more tolerable and can promote some of that decision making and adaptive problem solving, kind of moving on there. Another question we really had, I think, kind of moving forward here is, again, kind of with some of the scattered and variable literature there, but as we're thinking about how to support some of our kids and families, is really that key consideration of kind of for whom are we trying to support? What populations of kids and youth are we trying to reach? Both also around kind of chronological age, obviously what that looks like for a 7-year-old working virtually, therapeutically with the kid will be very different from a 16-year-old. But also thinking about that mental health profile piece, and that goes back to kind of that dual access model or that pyramid that we talked about before, thinking about are there certain symptoms or mental health profiles we're really trying to kind of target compared to others? Because again, those with real elevated traumatic symptomology and distress might require a different program from those that are managing, but also having a tough time during that process. We can also begin to think about the length of the program and what that looks like. Some of our programs here at the clinic, a 4-week parent program is going to look very different from a 12-week program. And some of the targets and outcomes and processes that we're really trying to implement and validate and we'll hope will be an active ingredient as part of that support process will be really different depending on, again, what that looks like over the course and almost kind of dose of treatment there. And we can think back to kind of the when. Again, whether this is something kind of during some of that treatment and care process, or is this about kind of longer term, 1 or 2 years or even longer post kind of care treatment? And that's where I'm really curious about your experiences and questions about what you see and are hearing from the kids and families that you support. Because again, I think there's a lot of shared wisdom here in the room about that. And also a big question there about kind of who is that involving. And again, this is something we're always really trying to find a delicate balance around. Is it, for that 16-year-old where they do want some privacy and removal back to the parent, but also what are those mechanisms to be promoting the adaptive kind of family system and response there as well? How do we include parents and caregivers? How do we support them with their unique needs and concerns as well to be able to support their child? And that's especially true for some of our younger ones where we're often can be much more effective by supporting the parent to help or caregiver and supporting them directly rather than the child, because by virtue of the parent doing well, the child will also be doing well in addition. And then lastly, I think as we're thinking about these, again, kind of idea of these kind of core elements and what's kind of doing the work as part of these successful programs, continuing to think about what we're now calling kind of this third wave of kind of cognitive behavioral therapy. It's incorporating these ideas around, if you're familiar with dialectical behavior therapy or ACT, or Olivia mentioned some of this mindfulness-based stress reduction. And that does have a bit of a different lens or framework compared to promoting coping skills. So rather than kind of reducing distress and how you're going to respond and deal with this, it's really taking on a bit of a different flavor that way. And I just have kind of one graphic that illustrates that a little bit here. So you can see here, it says, kind of, Tina, in order to overcome your fear of physical intimacy, I really urge you to try to embrace your demons. Embrace, couldn't I just shake their hands? So it's this kind of idea with this third wave about acknowledging the discomfort and the pain and the distress that we're in, and acknowledging that rather than kind of pushing that away, really trying to build up some of that tolerance and space to validate those really difficult feelings, to think about how we're going to promote and cope and respond to these uncomfortable sensations. And I think why that's where in kind of the literature and the intervention programs Olivia talked about, why there's a lot of enthusiasm for that, because it matches up well with, I think, some of the realities and experiences with children and families and what they're continually kind of having to deal and manage with. So just in kind of conclusion here, to spend some kind of time here for questions. Again, we're coming here today as some kind of novices in some regards. Again, we don't offer at this point cancer-specific programming for kids or parents. We do have some other kind of programs that if you do know a family or youth that might be struggling, you can check out some of our programs there on the web. And certainly virtually here, I'm really excited by that component in that it gives us a much larger geographic region that we can help support. Yeah, I really want to kind of thank everyone for kind of just joining us here over perhaps your lunch hour here today. And hopefully we can have some kind of time for questions to see how this is matching your experiences and what you see as some of those needs for the kids and families that you support.